Hi, I'm Elizabeth Hess. I'm here with the administrator of the Champaign-Public Health District, Julie Pryde. I want to say thank you, Julie, and how are you?
I'm good. How are you?
I'm doing okay, except for the fact that I'm hearing and I'm sensing and I'm reading that the numbers in the county and in this area are going up. Can you give us an overview of what's happening right now?
Yep, let's look where we are right now. So as of this morning, we're up to 225 active cases. So that means 225 people right now in isolation, hundreds and hundreds in quarantine from those cases. And right now we have 15 hospitalized, and that's both of those numbers are about as high as we've been in this whole pandemic. We have 101 cases cumulative in kids under 10 years old, and those are going up, and 269 cases in kids that are 11 to 20. So we have, around 370 kids, school-age kids, cumulative infected. We have, right now, as of today, they reported another 1,298 cases in Illinois with 10 new deaths. And as you probably know, the United States now has 157,000 deaths from COVID. And right at this moment, it's about going up about 1,000 a day, which is unheard of. It's just, that's a lot.
You mentioned at the beginning of your statistics the amount of kids that are getting it. At the beginning of the pandemic, we were thinking it's old and infirm, and now we're seeing that kids are getting it as well. We don't know long-term effects. It makes people nervous to put kids in teachers and then send them back home after they've been with each other all day. How is this school year going to be effective with kids going into a classroom 18 at a time?
Well, the only way that this is going to work is if the schools can operationalize a plan in such a way to make sure that the kids stay 6 feet apart from each other throughout the day and masked. So I know a lot of the schools are having an option. So you can either have virtual learning exclusively, or you can have in-class learning. There need to be a lot fewer kids in the schools for this to work. And they have got to maintain the 6 foot distance. That's key, because any kids who are within that 6 foot distance for more than 15 minutes, even if they're masked, which they do need to be, they're still going to be quarantined if they're within that space of a case. So it's going to be, it's going to be rough. There's so many variables that the schools have to look at. Everything from, kids that can't stay at home, that can't learn well in that environment, that don't have the resources to do that. There have been a lot of really creative solutions put out there. One, involves basically putting kids into gyms or any empty building that's close to their neighborhood. There's all kinds of things being floated around, but the key is kids do get this. Kids can have serious outcomes. We have a lot of children in the schools who may have underlying health conditions or obesity or things that put them at an increased risk for a serious case, or they go back home to family members who are in that same boat. And of course, that also goes for parents, for teachers and staff as well. So this is, it's a really complicated thing. We put out our guidance. Our guidance is pretty clear, regardless of what any other guidance is. This is the safest, down to this is not safe at all. And safest is only virtual learning, and not safe. Now, I'm only talking about COVID. Not safe, of course, is going back to things as they were prior to the pandemic. I can't even imagine thinking about going to school in some of the places in Florida, Texas, and where the cases are just completely out of control. There's no testing. There's no capacity for contact tracing. I can't even imagine that. That's going to be very dangerous.
Coincidentally, I have friends in Georgia and Indiana, and their kids started today, face-to-face learning with masks. So would you consider that sort of a guinea pig model? Sadly, we're sending kids in other states, and we'll see what happens in 2 or 3 weeks if this is actually going to work.
Right. I mean, we're going to see cases. There's no doubt about it. Anytime you can't, like I say this all the time, you cannot keep someone with COVID out of your workplace, your school, your anything. But if you have proper infection control going, and it's consistent, then you can prevent an outbreak in that setting. But that's going to be the trick for schools. You can make anything look beautiful on paper, but when it comes down to actually, operationalizing that plan, you're dealing with so many variables. Kids, all the different ages of kids, and what they're able to do, what they're willing to do, it's going to be rough.
And one of the questions I know you get a lot is, well, we're going to need to bring in a babysitter or a tutor. How can you safely bring somebody in, or maybe even have your students learn in pods with 2 or 3 other classmates, take turns at each other's house for the day? How can you safely implement that plan?
Well, that is another issue, is with, of course, anything you can do virtually, but that's different. If a child needs a sitter, they still really need to be at least 6 feet away and using masks. So that's whether you're in the house, whether you're in the school, it doesn't matter where you are. If you're introducing somebody else that is not in, somebody that's not in your household, basically, you need to make sure that you are wearing masks and staying 6 foot apart at all times. And there are going to be families that, once the kids go to school, they're going to need to wear masks in the house and stay 6 feet away from people in their house too. If that is, it's probably not going to happen, but that is the type of thing that must happen to prevent spread. So if you have someone in there who is at risk, that would be the type of thing that you need to do. So it's, again, we know how to prevent it, but all public health is looking at really is how to deal with the virus. We're not having to deal with the really hard part of all the parent concerns, student concerns, teacher concerns, staff concerns, social emotional learning, all that. All we're talking about specifically is how do you keep the virus from infecting someone else? And we know how to do it. And where it's being done, it works. And again, it's literally as simple as maintaining at least 6 foot distance and wearing masks all the time.
I'm glad you brought that up. Okay, we've gone over wearing masks, we've gone over 6 feet of distance, and we've gone over washing your hands as many times as you even think about it throughout the day. Let's throw a new one in there that I've heard about, goggles. Are goggles going to be the new mask?
I don't think so, except for if somebody is in a situation where they are likely to get, direct droplets spread to their eyes. So they shouldn't really be, if people are masking, then you shouldn't even need to worry about that. But if somebody coughs and sneezes in your eyes, yeah, you can get whatever virus is going around, but I can't see us all wearing goggles around. We can't even get people to wear a simple piece of, cloth over their face to prevent spreading this. So there's no way they're going to do goggles, but really that's more for, probably if I were working with little kids, I might consider doing that, or a face shield or something over my mask, because they're more likely to, cough and sneeze on you. Same thing with adults who have issues that maybe make it less likely that they're going to use proper etiquette when coughing and sneezing. But in general, no, I don't think that's going to happen.
You're talking about the adults and kids who live here now in this area. We're about to have an influx of 30,000 people into our area. My friends' kids move in August 14th through the 20th. What are we going to do in order to keep the community as a whole safe? Because they're going to be going to the same places we do for shopping and for doctors and Walgreens. I mean, how do we keep ourselves safe from all of those kids?
Well, first of all, the kids are probably looking at us right now and asking how they're going to keep themselves safe from us, because we're not doing that great as a county, honestly, at keeping the virus down when we should be. But what is going to happen with the U of I is really kind of a unique situation. They are going to have, the kids coming back, and I probably shouldn't call them kids, but the students are going to be coming back. They're going to be getting tested twice a week. It's going to be mandatory, and that's going to, this is like, the U of I is going to be like a public health, like, perfect experiment. This is what needs to happen. You know, there needs to be adequate, super fast testing, and it needs to be done constantly. So, and again, the point of testing is not really so you just can personally know, oh, hey, I have COVID or I don't. It is so that public health can come in and do our interventions, which is, you know, isolating them so that they cannot spread it any further, quarantining everybody that's been associated with them. Plus, the U of I has, you know, the SHIELD program, and they have an app that goes with it. And so they're literally going to be doing what the entire country needs to be doing. I would be thrilled, super thrilled, if we had, you know, that fast of testing everywhere. We wouldn't be dealing with this, but that's not the case. So Champaign County, we have really good access to testing right now and fast test results, and our health department has plenty of contact tracers, you know, so we're ready to go. We're ready to go with this. But like anything, you know, it's going to we're going to all have to be a part of this. So that means that we need to keep house parties down. We need to figure out how to not allow house parties, and those are going on right now without the students being back. So that's anyone, baby showers, wedding showers, anything like that, parties, cookouts. Anytime you're gathering people together, we're having outbreaks. So we need to, I don't even know how to get this message across any plainer than I am, but anytime you gather, you are risking getting infected or infecting others.
Let's say I go to a barbecue this weekend. I'm asymptomatic. My test hasn't come back yet. How long have I been contagious, and how long after I get my diagnosis am I still contagious to those around me?
Well, you're going to be, okay, so I'm not 100% sure I get that question, but I'll just say this. From the time that you show symptoms, you were infectious 48 hours before that, and your symptoms can be super mild symptoms that you might not even recognize. That's why this virus is so insidious. It does transmit when you're asymptomatic, it transmits when you're pre-symptomatic, and it transmits when you are symptomatic. So it's really spreading around a lot because people assume that they're okay. That's why the universal masking is key, because we don't know if we have it while we could be transmitting it to other people. So we don't know if we have it, and we are going to be infectious for, you know, up to 2 weeks. So it's the masking is just key. You have to continue to assume that you are infected. Everybody you come in contact with, you have to assume you're infected. You have to assume they're infected.
Do you consider it a wasted test if I go get a test, but I'm asymptomatic, but I'm going to see somebody? You don't think of any of the tests as a wasted test?
No, the tests are not wasted tests. Originally, we didn't have capacity to do very many tests, so the goal there was completely different. But now, you know, we needed people to have symptoms in order to do that. Now we're in a completely different place where we're constantly trying to screen people to get them out of circulation, if you will. That's not really a good way to put it, but we're trying to get them out of the, you know, get them isolated so that they're not risking infecting anyone. And so when you're asymptomatic, you can be spreading it. So if you happen to find out that you were infected then all the better, because you wouldn't have a chance to infect anyone. So again, if we test or no test, you just have to always assume, like right now, I'm assuming that I am infectious. So if I get up out of my seat and walk into the hallway, I will have a mask on. And like I said, you're never going to prevent somebody from coming into your whatever, your business or school or anything that has it, but you can prevent getting it. You can prevent an outbreak.
We have an election coming up in roughly 90 days. I am so nervous. I don't want to go into a polling booth and touch everything. Would you recommend doing the voting by mail? Is that what public health's concrete recommendation is, that you do that in advance, do it now?
Yeah, so it's like anything. There's a whole spectrum of things. Obviously, the safest would be voting by mail. So you can, you know, apply for an absentee ballot or whatever early, just by going to the county clerk's website. You can do that. And so voting not virtually, but voting by mail is the safest because you have no contact with anyone. The next would be going to early voting, calling ahead, finding out when it's not as busy, then going there with your mask, doing your social distancing, when it's less busy. And then it goes up from there to going to a polling place on election day when they're usually busier. But again, you still have to maintain that distance. You still have to, stay away from people. Everybody needs to wear a mask. And that once you get, like that, you don't know if people are going to be following the guidance or not. So that puts everyone at a little more risk. So anyone who is at risk, definitely, order your ballot. You can do that anytime now, and then just be ready to do it that way.
Last question before I let you go. People are looking forward to a vaccine and, dare we think, a cure. You've been working on HIV and AIDS for a big part of your life. We still don't have a cure for it. We've come a long way. Is it going to be like that, or will we, please tell us, have a vaccine and a cure, and it's easier to ascertain that than it was for HIV and AIDS?
Well, they're completely different kinds of viruses. So everything is pointing toward the the availability of a virus within the next maybe 6 to 8 months. There's quite a few studies going on right now, and several of them are looking really promising. So if you can get a vaccine, the ones right now look like you may need 2 doses, but that's okay. It would be ideal if you could get 1 dose and get really high immunity from that, but I don't look at this to be like HIV/AIDS. I certainly hope it isn't. But I just actually posted something about that last night. HIV, we have had in the U.S. about 655,000 deaths from HIV, and that's from AIDS, and that's taken 40 years. We're up to, as of today, 157,000 deaths from COVID in 7 months. So that is astonishing to me. Of course, now we have drugs that do a lot of good for HIV and the antiretrovirals, and so it's almost like a chronic manageable disease now, or it really is. But with this virus, let's hope it's not going that way. But it does look like the vaccines are promising, and if we get them, we'll be doing everything possible to get them out into as many people as fast as we can once we get access to that.
And never run out of things to ask you about this virus. And I want to thank you. I'm looking right at our producer, Jason Liggett. Thank you very much for letting UPTV and us and be a part of this. I want to thank Urbana Mayor Diane Marlin. She's always very gracious to let us run this. Julie Pryde, Administrator of the Champaign-Urbana Public Health District. I don't think I've said this yet, but thank you and hang in there. Whatever people are telling you, you're never going to please all of the people all of the time.
that I'm aware of, and I always have been. Thank you very much.